Rob Clark's whiskey talk, I think it's bigger. So, oh my gosh.
Pretty sure that was the whiskey. That was the subject, not the speaker.
It was the free shot.
Well, I'm Jeannie Maudlin. I'm the president of the Friends of the Working Men's Institute. And on behalf of the board, we're delighted to have you all here this evening. Really, quite honestly, on a February evening, is there really anything much better than gathering at your library in community to hear a wonderful lecture, actually the first in our 2026 WMI Lecture Series? Our board thinks not, and apparently a lot of you do as well. Thank you for coming out. So tonight, it is our pleasure to welcome to our podium a New Harmony resident, Mrs. Karen Nelson Moser. Now, Karen is a woman who wears many hats. She's a wife, she's a mother, she's a grandmother. She holds an MFA in acting from the University of North Carolina at Chapel Hill, and she has put that degree to great use all around the country. Perhaps some of you had the great opportunity to watch Karen perform as an equity actor here in New Harmony over at Murphy Auditorium when New Harmony had its popular summer theater program. Or maybe you caught her one-woman show at Lowry Hollow. Or maybe you heard her narrate A Christmas Carol by Charles Dickens, you know, that wonderful puppet show that was created, produced, and directed by her husband, Paul Moser. Or maybe you were at our July 4th program and got to hear Karen read the Declaration of Independence. Or perhaps you just came into WMI on a Tuesday and noticed Karen sitting alongside the other volunteer archivists as they catalog and research New Harmony's vast holdings. Well, tonight she's wearing a whole new hat. She's going to wear tonight the hat of sister and traveler. Last year, Karen got to take a very important, a very special trip to Africa. And tonight, she's going to introduce us to Dr. Robert Nelson. And she's going to share with us her legacy experience. She's already here.
Thank you so much for coming. Can you hear me okay? Okay. Oh man, this is wonderful. Thank you. I want to thank Jeannie and her, where'd you go? There you are. Thank you. And her wonderful team of board members. It's a lot of work to put on a lecture series like this for us all to enjoy throughout the year. And I want to thank Ryan. Thank you, always. What I want you to leave with this evening is a feeling of hope. Hope is energizing, and we need it during these times. So I want this to be a joyous event. I'm going to start with this 3-minute video to give you an overview of the Ampath program. I was invited by my brother's colleagues to join a small group to learn about this program. And I didn't hesitate. They got on the phone, we're going to Africa with Ampath, do you want to go? And I said, yes. And so there we are, and I'm very grateful for it. But after this 3 minutes, then I'm going to go into my slideshow and talk more about my personal experience. There are a lot of people here who've been to Kenya, and so I hope they'll share it with anyone about that. So Laura, of course, and her sister Katie helped prepare me. Anyone else here jump in?
Ampath has always been about partnership and about people. We're a partnership of academic health centers and universities working together to save lives in Kenya and, more importantly, to improve healthcare around the world.
Almost 30 years ago, Indiana University and Moi University in Eldoret, Kenya joined together in a collaboration now called Ampath, the academic model providing access to healthcare. Ampath brings together more than 13 universities in North America, with Moi University, Moi Teaching and Referral Hospital, and the Kenyan government. Ampath became one of Africa's largest and most successful HIV care programs through this visionary model of partnership. Gradually, Ampath expanded to care for a population of more than 4 million Kenyans at 500 clinical sites around Western Kenya. And Ampath has trained more than 1,000 North American medical students and residents, giving them an invaluable global medical experience.
So today, Ampath is using our network and our incredible foundation to do something truly innovative. We are changing the paradigm. We're building Sub-Saharan Africa's first comprehensive integrated healthcare network, a new system of sustainable care and empowerment for an entire population. We're going beyond reactive crisis health emergencies that can trap families in poverty.
This population health initiative expands Ampath's current partnership to include Kenya's national health insurance provider. A high-quality, low-cost health insurance product will be available to all Kenyans in the Ampath network.
For the first time ever, families will know they can access and afford community-based health services like care for moms and their kids, treatment for diseases like cancer, malaria, and diabetes, and payment for prescription drugs. They'll also join community empowerment and micro-lending groups that address the root causes of poverty. Through population health, we are enabling economic self-sufficiency, creating an effective healthcare delivery system, and supporting that system with a universal health insurance product.
Ampath's Population Health Initiative holds promise, not just for millions of Kenyans, but for scaling up worldwide to bring healthcare, opportunities, and hope to the poorest communities around the globe. Ampath, leading with care.
One Planet, One Tribe, the Ampath program in Kenya. Health is global, and the exchange of knowledge benefits all countries. Why did I go? My brother. So I told you his colleagues invited me. He used to say, you know, when my work is done here, I'm going to Kenya, and I'm going to stay. And so he kept, I think he told me that through the years to prepare me for his going. But of course, his work was never done here. And he couldn't leave his sick kids at Riley. So I went for him. He used to say the immune system was the key to the future of medicine. He did his residency in immunology at University of South Florida. Their team worked at Tampa General and also at All Children's Hospital in St. Pete. One example of the time was he had a patient who was a young man who was refused his medicine at a pharmacy. This was a time when there wasn't even a name for HIV/AIDS. And so Bobby drove 50 miles one way to get him his medicine. I don't think he was alone in that, but that's the person he was. So in the early 90s, he set up the first maternal child conference in the state of Florida. He wanted my cousins, Sandy and Scott, and I to come down and help him pick people up at the airport, hand out the programs. But more than that, he wasn't married, he never married, he married his work. So we were his little family, and he wanted our support, and he wanted us to learn about what he was doing and to share that. The one standout memory I have from that time is in one of the sessions, a woman was there talking about her experience with her child, and she said that Dr. Bob treated her child as his own. So he and his team developed a very simple, cost-effective procedure during birth that reduced the maternal-infant HIV transmission to a rate of 4%. So it's very low, and that continues with very little effort and cost. So he spent 20 years down there working in AIDS, and then he moved up to Indianapolis in 2000 and worked in immunology doing bone marrow transplants. So he's my why. Hope. People would say to me, could you sum up in one word what you brought back with you? And to me it was hope. I saw hope in action. I felt its power. I came home with it. I'm grateful for it. And I know it is not confined to Kenya. So I like to get to know the people there who guided us and who drove us places. And so I'm sitting up in the front of the car with Edward. And I asked him, where are you from, and those kinds of things. And he asked me where I was from. And I said, well, I'm from a small town in Indiana called New Harmony. And he goes, New Harmony. I love the way he talked. And then I said, yes, New Harmony. People say that you don't choose New Harmony. New Harmony chooses you. And he goes, you don't choose New Harmony. New Harmony chooses you. That would make a good pickup line. I said, oh no, Edward, no, that's not gonna fly. And we laughed and we laughed and we laughed together. And then he goes, Karen, New harmony for the world. And I said, oh, that'll fly. Yeah. So, oh, there's Robert. He was our guard at the IU compound where we stayed. And he'd been there for 20 years. And that's one of our guard dogs. That's Sarah. Yeah, she looked just like Gretel. Anybody who knew Gretel. So then we get there, and this is, now we're actually in the hospital, Moy Teaching and Referral Hospital. And we're sitting around the table with a government official. He was an administrator in public health. And he wanted us all to go around the table and tell him why we were there and what we did. And so, you know, they're all medical people. And I'm going, oh, what am I going to say when it gets to me? And I mean, there was a young resident in pediatric pulmonology, there was an oncology nurse, there were people involved in the history of medicine who'd been to Africa many times. And so I'm sitting there. He gets to me and I said, well, I'm here for my brother. And he got up out of his chair and he came over and he gave me a great big hug and he goes, "You here for your brother? Oh, you're here for your brother." And he understood. And I'll tell you, I never felt more welcome in my life, right? Yeah? So then we get to, see that guy? This guy, right here. That's Dr. Zach. And he was he was very passionate and he talked to us about his program. He was a pediatric team leader in HIV/AIDS. And he sat by me, but he kept checking his phone. And so, afterwards, we were talking to him, and he said that he had a 14-year-old patient, a young boy, and this boy had done 14 doses of his regimen. And he only had one left when USAID and PEPFAR were cut. And he was terribly sad and upset about having to tell this young man that. However, he scraped and his team got together and they got the money for this boy's last dose. But he was afraid it was too late because the viral load had already started going up. But he got his last dose and he was checking the labs. So he was very, agitated about this. He was typical. He's young. You get the bug. And when you go to Kenya, those of you who've been there, most people want to go back. Well, he wanted to go back. He brought his family and they live there now. And that is not atypical. That is not atypical. Some of the partnerships with Indiana University are Temple, University of Louisville, University of Texas, Purdue, Brown, Duke, Mount Sinai, Alberta, Toronto, Stanford, U of Virginia, University of California, San Francisco, NYU, and now Ghana, Mexico, and Nepal. I'm going to go really fast. So We're still in the hospital. The doctors like to talk about Joe Mamlin. They considered him the founder of Ampath. And so throughout they were telling us anecdotes about Joe. And one thing he would say was, we can't wait until something is perfect to begin. We necessarily plan, of course, but the key lesson seems to be to begin. So these folks were seeing people in closets, 3 to a bed. Families would come in and share food with each other. They were performing surgery in a little room, and George Rapp from New Harmony was very much part of Ampath. And he went over and said, hey, you don't have an operating room. I'm going to build you one. So that's how that happened. And he continued to go throughout the years, and his son John goes now. Another thing Joe Mamlin said was, when I don't know what to do, I say to myself, she is my mother, her child is my son. As long as I remember that, everything else makes sense. So now we've got USAID and PEPFAR. That's Tonya doing her little thing there. But she's talking to this guy, a doctor, who's telling her we desperately need nurses. So what Tonya did in the pink dress, okay, she went out into the villages. She's from Indianapolis. And she saw that children with neurological disorders, including autism, were untreated. They were shunned, left to be in their huts. They weren't allowed to go to school. So she saw this firsthand, and then she got on the horn and contacted the most prominent practitioners, educators, and researchers in these disorders. Then she found space at Moy Hospital where the children and parents could come for education and counseling and treatment and classes. And then she raised $5 million and built a clinic. So, but it starts in the hut. They don't wait and say, well, wait, we can do that, but first we have to raise $5 million, and then we have to build the building. They start. So now we're outside of the hospital. If you can see the children sitting along the edges there, they're too sick to participate. These children have chronic illness. They have sickle cell, cancer, HIV, AIDS, diabetes, things like that. But they firmly believed in song and dance and community as a very important part of the healing process. So there we are dancing with the children. They didn't want us to sit by the side. They wanted us to dance too. So there they are, that little guy with that little hat. He was so cute. All right, I want to go back to what I was saying about PEPFAR and USAID being cut. The HIV/AIDS epidemic left a lot of orphans, lots of orphans. And Ampath had different partnerships that helped find places for the orphans and care for the orphans And that was one of the first things that was cut. So now we're at Riley Mother and Children's Hospital, still on the Moy Teaching and Referral Hospital campus. And this is one of the doctors who was talking to us. And this is another thing when they talk about leading with care, they start with the patient. Just talking about a program where men and women with HIV were both given the same medications, but the men were improving and the women were not. And they couldn't figure it out. So they went to they went and they looked at the lifestyles and the habits and the villages, and what they found was the women weren't getting the same nutrition. And they weren't getting the same nutrition because they were giving their food to their children first and to their neighbors. And so that's leading with care. That led to nutrition programs and other ways for self-sufficiency and on and on. And the men are coming along. They're coming. Okay, so there's that. All right, now we're at Nawiri House. This is a recovery and skills center for people challenged with mental illness and addiction. After they're stabilized in a hospital, then they go for at least 6 months to this place, this house. It's like a house. And they have illness management, recovery training, life skills, and job readiness. So once again, you see, they don't just focus on an illness. They focus on the community. Here is Tulia Manor. This is an outpatient clinic and a family wellness center. And this is Creation Hive. So this is their business, great big thriving business that they have to employ people from the villages. And they do beautiful work, beautiful clothing. I have just little examples of their beadwork. My clothes are up in Wisconsin right now. But don't you love? He's reminded me of Gandhi. He was just his whole energy. And what he did, he works with recycled glass. They call it reimagining glass. And he makes glasses, cups and things like that. The gentleman at the top there, they make these incredible sculptures, and I wanted to put some of their pictures in, but I thought I have a lot of slides here, so I didn't have that. But they did incredible work. They measured us, and in 24 hours we had our dresses, our pants, whatever. So they made their own paper. And this is an example of some of the cards that they made. These earrings are made out of paper. And I got this necklace there too. Now we come to Julie. Julie was a missionary nurse. So she'd go out to where the sick and the dying were. And she was there exploring and trying to understand their needs. And then she took action and created a place for babies and everybody dying. Lots of dying children out there. She created a place and called it the living room. It was a hospice. Called it the living room. So you can read this for yourself. But I want to say, when she says every person is created in the image of God, there was no indoctrination. There were no religious denominations or whatever. Their religion was love and compassion. These are images of the living room. So it's hard to see, but they have little buildings all around. And they would minister to these people outdoors. And the families would come, and if they had to tell a family their loved one is dying, they would they'd go outside. And nature was a very important part of the living room. In fact, some people said, in my group, well, gee, when I die, can I come here? It was quite remarkable. So I want to leave Julie. She wrote a book called Brave Love, and she wrote, "It's love that moves me to action. Love looks exactly like this. A mama and her baby rightly seen, acknowledged, and accepted as valuable, even though the world and its systems scream that they are poor and insignificant." So now we're going to go to chamas, means groups. Chamas means groups, and so these were chamas groups for change. Community-based peer support model. And this is their program, and then I'm going to show you a bunch of pictures. So that's how they welcome you everywhere. Singing and dancing. All of these mothers with their totos, their babies. They bring you flowers. I mean, talk about a welcome. She put these on me. And then she said, "Welcome. You are my friend. I love you. You are home." And I felt like I was. Now, this woman here, she's the pediatric pulmonologist. Of course, they all wanted to know why we all were there, so we did that again. And that's Alex. And they wanted to know if she was married. They didn't ask the rest of us. They wanted to know if she was married because they had any number of gentlemen for her. So we teased her a lot about that. Here's some more mamas and their totos. And they are actually having an education session outdoors here. Now, that's a statue. Oh boy. This is the Great Rift Valley, called the Cario Escarpment. and it's way up high where the runners train, the Kenyan Olympic runners train there. So that's a big view there, and there. And then here's the track, and they let us get out and walk around the track. And then the track is right there next to the goats. And you know, I don't know if you guys saw this, corn. They grow corn there. It was beautiful. Less than a month old. Oh. We saw a lot of this. Look at him run. So cute. So we saw one, it was so wonderful to see groups of animals. Didn't you think so? Yeah. These birds, they accompany the elephants. They're like their guardian angels. And I mean, it's kind of symbiotic. They like to eat what the elephants leave behind. But little twin birds. There they are, taking care of the newborns. Look at them. We saw that a lot. The birds just perching right on the backs, going. Gazelles. We saw a lot of those. And these are, I keep trying to remember. See, a lot of people took more pictures than me. That's not my forte, number one. Too bad I didn't have Andy with me. But also, I wanted to take it in. So these are either a form of gazelle or impalas. Anybody wants to correct me on that? This is, see those little heads there? Those are hippos. Those little heads. There they are out of the water. I'm showing these because you're going to see how much it changes. This was all water and marshes and grasses and Kilimanjaro in the distance. And that's the tree that you see above, the acacia tree. Zebras. Oh, those are wildebeest with them. They intermingle. And they say that the wildebeest is one of the ugliest animals over there, but I didn't think so at all. I thought they were beautiful. And it is the, we're in Amboseli National Park now. But see, the zebras ate the tall grass, and the wildebeest ate the short grass. So they did just fine together. Laura, didn't you see them migrate? Did you? Oh, something, right? I didn't see that. Better shot of Kilimanjaro back there. That's sunrise. Yeah. That's the Maasai tribe. And they took us around through the bush. We had a great time with them. We sang, we danced. And this woman, I asked her, I don't know why, I asked her about their mourning practices when somebody died. And she was telling me that they shave their heads. And the mourning process is the process of growing the hair back. Now, these get a bad rap, too. I think they're adorable. They're walking around everywhere. Little guy. So cute. Then the giraffes. Oh, my God. Oh, now we're in Masai Mara. So there's a different land there. So beautiful to see them in groups. Look, look. See how their heads are all going the same way? That's because there's a predator here. And people, we were all going, somebody has to tell them. Because there was a lion over there on the other side of the road. But, you know, our guide said, no. They know. And besides, the lion just had a meal and he was not moving very fast. So, but look how they're all together. And they can run really fast, so they did just fine. Beautiful. Beautiful. That's where the giraffes were. So you can see them down in the front there. Hippos again. Oh, now these hippos are one of our leaders told us. He was interesting. He was working on his PhD, started in a slum in Nairobi, sold pencils, made enough to buy himself a bike. And he was tooling down the road, and 3 hippos were running after him. And they are mean and strong, and they can run fast. And I said, well, what were they going to bite you, or what? How does that work? No, they just trample you. So that's a candelabra tree. There's a lonesome elephant. So they're in these groups, you know, and after mating, the male then goes off and is alone. And we saw some had been there for, 40, 50 years old, walking around by themselves. Yeah. It was beautiful to see the animals interact with each other. It was really magnificent. So, here you go. I have one more thing I would like to read. This is from Julie's book, Brave Love. And she wrote, who gets to determine the limits of what is possible? And more importantly, for who? And what should be? If rockets can land on Mars, couldn't clean water be available to all? If a disease is treatable somewhere, then why not here too? Audacious things are only absurd, impractical, until they come to be. So thank you so much for coming. Who knows? I'm never going to do anything with technology again.
Oh my goodness, that was wonderful. You know what else was wonderful? All of you. When we were having our technical difficulties, you were fantastic. Visiting, talking, again, being in community. I don't know, perhaps New Harmony really does choose us, and aren't we all so glad that we were chosen and that we were all here this evening for this event. At any rate, Karen, the FWMI gives an honorarium to our speakers. Thank you so much for your work and for being here this evening. Ladies and gentlemen, if you enjoyed this, please support our organization. If you did not get our lecture series brochure, which is over there on the table, that's because we don't have your PO, your mailing address, or your email address. And if you'll take one of those, tear off the little form, fill it out, see our treasurer, Mrs. Shelley Batt, right here in the front row, give her your support, your check, your membership, whatever, then we'll have all of your contact information and you can be a part and know at least what's happening way ahead of time. Thank you to the director, thank you to the trustees for making the facility available to us. Thank you to all of you intrepid Rappites for venturing out tonight. Anything else, Director Rokicki?
Thanks for hanging with us during the technical difficulties. I swear to the heavens, we tested this twice and it worked perfectly both times. So sometimes that's the way it works around here, but the system is haunted sometimes. Next week, Rod Clark is going to be here giving the first presentation for the Owen McClure 200th bicentennial celebration. We're going to be talking about Robert Owen and his footsteps that he took in Europe and the things that led him to the idea of creating a perfect utopian society. So Rod Clark, next Wednesday, 6:30, right here. Thanks again, everyone.
Thank you. Good night.